A very warm welcome, everyone. I, Dr. Nishant Sharma, on behalf of Voice of Healthcare, welcomes all my viewers who have joined us on yet another episode of our virtual interview series on the occasion of National Nutrition Week. Voice of Healthcare, in collaboration with Espera Nutrition, has taken an initiative to bring together certain industry leaders, industry stalwarts, and medical oncologists and dietitians to celebrate and educate the public about the importance of nutrition during oncology treatment. Today, we have with us a very special guest, Dr. Ghanshyam Biswas, who's medical oncologist, consultant at Sparsh Hospital. Good day, Dr. Biswas. A few words of self-introduction, please.
Namaskar. So very good morning, Dr. Nishant, and thanks Esperer for this initiative. And so I'm a practicing medical oncologist for last 2 decades, and my roots of oncology starts from my alma mater, Tata Memorial Hospital, Mumbai, and after that, so I'm just here in my motherland or the state where I was born, and serving for almost 2 decades now.
Right. So it's a pleasure to connect with you, sir. I hope you're ready with the questions, and all my audience and the viewers are ready to be educated about certain newer aspects that you will introduce and bring to light about the care of nutrition and the importance and the pivotal role of nutrition in any oncology case. So setting up the foundation, I would want you to share your perspective on why nutrition holds such a crucial role in the journey of a cancer patient, and how do you feel that the patient's nutritional status impacts their ability to cope with the treatment and the overall recovery and the well-being?
So let me start with some figures which may astonish many people. So do you know that out of 4 cancer patients, so 3 patients will lose some weight so during their cancer journey. So 3-4 patients. The second astonishing figure is that 1 out of 5 cancer patients, it means around 20% of cancer patients, they actually die of nutritional impact or a malnutrition. So
Okay.
which is nowhere related to cancer or the treatment related. So 20% is a direct mortality in cancer because of a nutritional impact. So
Right.
now let me bring you certain points which I've been telling in many of the forums. So this can be a highlighter and which can summarize what we are going to talk today. So nutrition in cancer is a Pandora's box. So we undermine it. Many of us don't know the magnitude of this problem. We are just probably looking at the tip of the iceberg. The
Mm-hmm.
concerns for the patients and their relatives were always there. So probably as a treating physicians or as a caregiver, probably we did not understand that, like cancer and nutrition, cancer and anemia, and cancer with psychological issues were definitely undermined.
Mm-hmm.
So now the importance is getting there. Initial few years or decades, it was almost a pharma driven, and that was a backdoor entry to the nutritionist. Now, so the oncologists, so be it a radiation, medical, or a surgical oncologist, so they play a direct role in the cancer nutrition. So
Mm-hmm.
now it's no more a pharma driven. So there is a science, there is an evidence, and we should, the caregivers or the oncologists should consider your dietitian or the nutritionist in your team, because we talk about comprehensive cancer care today, and nutritionist plays an important role because we should not undermine. So now,
Right.
how does this impact? So there are direct because of cancer related itself, and there are
Mm-hmm.
indirect, which may be because of your chemotherapy, today targeted therapies, and then immunotherapies. It can be because of surgical resection, and
Mm-hmm.
it can be because of radiation. So many a times it is because of mainly in a GI cancers. We talk about pancreatic, we talk
Hmm.
about GI gallbladder cancers, colon cancers, stomach cancer. So these are cancers where nutritional is markedly seen. That
Hmm.
doesn't mean that there are other cancers where we don't see. So in our part of the country where head and neck cancer is more common, so where
Hmm.
post surgery chemoradiotherapy is so important, and concurrent chemoradiotherapy is a standard treatment, and 40, 50, 60% of the patients is going to lose weight. So and
Hmm.
that's an important factor.
So I think it's a very well summed start to our discussion here about the importance of how it's not just about nutrition for cancer cases, or not just cancer cases and nutrition. It's the overall importance of nutrition is what you're trying to suggest. Moving on, so every cancer case is unique. Like you were just talking about head and neck, you were talking about GI cancer. How do you feel that any tailored nutritional recommendation to an individual patient can help? And if possible, give us some example where in the past of your medical practice, a certain tailored dose of nutrition has helped a certain cancer case.
So one should understand that the cancer nutrition aspect or the importance is not when the patient actually loses weight. So,
Okay.
so as I said, so we need to have our dietitian or the nutritionist in a team, and their role starts straight away with the cancer diagnosis. So there is something
Okay.
called preparatory. So you are preparing a patient for a chemotherapy, you are preparing a patient for a surgery. So before those things, so you should have a basic nutritional assessment. So we say
Hmm.
subjective global assessment or the patient subjective global assessment. So you categorize that patient. So is the patient nutritionally adequate or a mildly
Hmm.
malnutrited or and that's how you plan your nutrition from the day one of the cancer diagnosis. So not in
Hmm.
the middle way when already the patient has lost weight or there is a nutritional impact. So
Hmm.
they are in the team, and that starts initially. And now, so over decades, so there were many pharma companies which focused on the nutrition, and we say so probably high protein diet, and many of us know that high protein diet may not be applicable for many because
Hmm.
intolerance or for
Right.
by many patients GI system is not there, is adequate.
Hmm.
So that's the reason now we talk about a balanced diet. We talk about
Hmm.
precision oncology, like in cancer. So medical oncology has gone
Hmm.
into a precision surgical and radiation, and so at
Right.
the companies like Esperers. So I've been associated with them. So now we look at different aspects of a nutrition. So somebody
Hmm.
we are preparing for a cancer treatment. So a part of nutrition. Somebody who's going through a cancer treatment, they require, and somebody needs to protect. Somebody needs to have uh, like the GI. So where knew that so much of uh, cancer nutrition or the proteins or the immune system has to be enhanced. So I think so. Not only the directed cancer treatment, even in the cancer nutrition. So we are going into a precision way, and over last maybe 2 years or 3 years now. So since that launch, I think so. So we are trying to put our patients into those customized, and it has been really beneficial.
Right. So, likely you said, building on the same, I mean, the role of a dietitian and the role of a nutritionist in planning, or let's say moderating or actually monitoring an entire oncology patient's journey can be divided into three segments. It's pre starting their treatment, during the course of treatment, and post treatment. So right now we have discussed about, let's say, the pre conditioning or the pre part of the treatment. Let's talk about during the course of treatment. So how do you, or do you really feel that nutrition can actually cope up with the side effects that one faces during chemotherapy or oncology care, and what are your views on that?
So let us take an example of a head and neck
Yeah.
cancer. As I said, so these the patients goes for a surgery after almost a month. So they come to us for chemoradiotherapy. So if you
Hmm.
don't plan a good nutrition for these patients, so in the midway from third week onwards, so this patient is going to have definitely more than 10% of weight loss or more. So by the time he
Hmm.
completes 6 weeks of treatment, so either you put a peg
Hmm.
or you put a Riles tube, or you put your patients on some of these oral nutritional therapy, because even
Hmm.
oral nutritional therapies after 3 weeks, many times it is difficult because there is a lot of mucositis and these patients are difficult to deglute. So I
Hmm.
think so this is one cancer case,
Yeah.
so where so many even many nutritional companies have researched on this, that so this is one prototype of cancers where so you need to take the importance of cancer nutrition. So I think so that's the way to go in head and neck cancers, and especially GI cancers, where the cancer nutrition has a big impact.
So, yes, thank you, Dr. Biswas. I think that summed up very, very nicely about the care that nutrition will actually play during the course of any treatment and managing the side effects. Now, moving on to I would say, the last question of this session, I'd like to divide this question into two parts. One would be, let's talk about the post-treatment nutrition. What importance, or how do you feel that managing the correct level of nutrition for a patient who has survived cancer plays an important role? So over to you, the first part of my last question. Yes.
So why nutrition is important? Because so let's have so not only the body's immune system goes down, and once the immune system goes down, so you are at risk of opportunistic infections. So somebody is a diabetic, so uncontrolled
Hmm.
diabetes and a proper poor nutrition, so there is a wound healing, and
Hmm.
all these put together also impacts your hospital stay, and indirectly the expenses you are doing for particular treatment, and ultimately it takes on the survival part. Now somebody has completed treatment,
Hmm.
so in oncology we don't try to segregate that you don't take this food or that food, because we understand that these 6 weeks and subsequently patients will lose patient is going to have a loss of taste, that there will be a burning sensation in the tongue.
Hmm. Hmm.
So we try to say them that you go back with your
Right.
conventional food. You add less spice because you won't be tolerating, and you try to take all cooked foods,
Hmm.
and so don't order like the foods from outside. Otherwise, homemade a balanced diet.
Hmm.
So I think so that's most important. And somebody who goes back, so the cancer treatment is over, the psych is over, so it is time to recuperate. So
Hmm.
the patients will improve. So I think so they can go back to their normal diet and avoid all those
Hmm.
junk food today, and always prepare a home food. So if I'm going to my office daily, so I try to take foods along with me, unless and until somebody is ill at home, so who cannot prepare. Otherwise,
Hmm.
so it is the best part
Right.
you do it.
Okay. So, talking about, let's say, one last part of the question, where I would want you as a medical practicing oncologist to give some key pieces of advice that you feel are required to consistently ensure that this nutritional care is taken by every cancer patient, kind of like a public awareness message from your side to everyone else.
So I will say that so we as a as caregiver have always undermined the importance of nutrition. So I'm talking
Hmm.
about cancer and nutrition. So let's don't undermine or or the magnitude of the problem that can arise because of actually ignoring importance of malnutrition and nutrition in cancer patients. So let's
Hmm.
focus that. So there is a science and there is an evidence for that, and we are also into a tailor-made or a precision cancer nutrition. So now there are
Hmm.
patients who are obese patients where there are preconditionings like the intermittent fastings. We talk about keto diet, so that's also there. So in one aspect we talk about the malnutrition part, and the other aspect is also we see not in India maybe, but in the Western world. So there are problem
Hmm.
issues with high BMI and those issues. So let's let's accept that the fact that nutrition plays an important role, and by addressing the nutrition part, so you are going to improve your patient's outcome as a whole.
Right, sir. And I think very rightly said that it's based on evidence. And we've seen over the last years that it has played a very pivotal role in the management and in the bringing back the homeostasis for a person. So, with this, I'd like to bring this session to completion. I thank you, Dr. Biswas, for sparing your valuable time and educating all the public about the importance of nutrition and while celebrating this National Nutrition Week. I thank you, all our viewers, for joining and understanding what a pivotal role nutrition plays during oncology and cancer treatment. Thank you, Dr. Biswas. It was a
Thank
pleasure
you. Thank you.
connecting with you. All
Namaskar.
right, sir.
Thank you.